The mouth is often an early warning sign for disease, inflammation, toxins that can flow from the mouth throughout the body and contribute to chronic systemic diseases like diabetes, heart disease, and cognitive decline. Biological dentistry is a branch of dentistry that's relatively new that addresses this, but unfortunately, it is not the norm. So I want to make sure that everybody understands this option out there for their health because it's a powerful perspective and powerful approach to oral hygiene that can also help your systemic health as well. And today, Dr. Shawn and Ben Javid, two brothers, have a practice in LA, a dentistry practice together, have been doing this for many, many years. I met Ben at a conference recently, and I was so impressed by what he said, his approach, and what we talked about that I had to have them on to share this information. So thanks for coming on the show today, guys.
Thanks for having us, John. It's definitely, it's a pleasure.
So how would you define, kind of what you guys do and the general approach of biological dentistry? Because there are, I believe, training programs in this and way people can get, educated, doctors can get educated. And how is it different from what you learned perhaps in, just conventional dental school?
Right. What we like to equate it to a lot of times is, functional medicine in the world of, healthcare. It's not the mainstream. Number one, we are looking at the mouth-body connection. That is a big deal that is totally overlooked in mainstream medicine and dentistry. They treat the body in silos and not as a whole connected unit. So that's one big factor. We look at materials and toxicities that a lot of times are being introduced by mainstream medicine and dentistry, specifically in the mouth, that are contributing to this toxic load and chronic health issues. And if we want to be specific, metals, treatments like a lot of times infected that cause infections on teeth, like root canals, a lot of times, and other sources of infections in the bones, we work with that are not really taught in dental school, so we want to address these things.
Yeah, mercury fillings.
Yeah,
those mercury fillings.
Obviously,
metals.
Mercury is a big source of toxicity and heavy metal toxicity. Biological dentists, as an entry level, we have to know how to remove mercury safely from the patient. A lot of times, dentists that are moving in this direction of biological dentistry, that's one of the first things you learn is, how to remove mercury safely.
I mean, to me, I usually like to kind of put it in a nutshell is that dentistry, I've been practicing for 30 years. Dentistry, they get you kind of ready to be able to just put a patient in a state that they're not in pain. As long as you don't have pain, you're fine, right? That's what dentistry is about. They don't look at the materials. Biological dentistry, the material matters. What kind of material is biocompatible to you that goes into your mouth that's not causing systemic issues and autoimmune issues, and to remove toxicity, like Ben was talking about, bony infections, root canal infections, mercury fillings, remove it carefully without exposing the patient, to get systemic. That's the most critical thing.
So let's talk about those three things that you mentioned: root canals, bony infections, and mercury fillings, because I want to, kind of unwrap all of those and understand, first of all, why somebody would get them. I know why somebody would get a mercury filling, but is that still common practice to use mercury in fillings today? And then is it that once you have it, it's forever, or at a certain point, my understanding is that mercury fillings will off gas with every bite of food, will release mercury that then people, swallow or can inhale into their lungs. And over time, though, so many years, perhaps, I don't know how long, it doesn't off gas anymore. It's no longer an issue. So talk a little bit about the mercury fillings and when you take them out, when you wouldn't, and how you do that.
Yeah. Well, with mercury fillings, obviously mercury is one of the most toxic materials on Earth that we can utilize for any purpose. If a little bit spills in a room from a full thermometer, you have to have this, special suits to clean it. And these amalgam fillings that were introduced in the late 1800s are made with more than 50% mercury. And then the way we were taught in dental school is that because this is an amalgamation of different metals, they are safe. There's no mercury being released. In fact, we would manipulate them, utilize it in your hands, and so there was, there was a complete disregard to any kind of safety. Now, one thing I want to mention before we get into mercury a little bit more is that all metals were against in biological dentistry. Any metal. In fact, any metal in your body not only leads to heavy metal toxicity, obviously amalgam fillings were the worst of it all, but they are also a block in the meridian channels. If you have a dental implant that's made of titanium, you have a block in that meridian channel. And for your viewers, meridians, obviously, they might not be familiar with. They might, because it's your podcast, they might be familiar with it. But obviously, if you go into an acupuncturist or you know about acupuncture, they're working with meridians. When there's these natural energy lines in the body, that if there's a block, it can create health issues along that meridian channel. Now, metals are a block for that. And also, the third component of that is they're attracting EMF. Now, we all as a society are more familiar with the term EMF, electromagnetic frequencies that are coming from all the electrical devices around us. We want to block them. We know our phones, the wires around us, microwaves, all this are emitting these frequencies. We want to block it from our cells. It affects our cells in a tremendous level. But when you have metal, any kind of metal, in your body, you're now an antenna. And in fact, for those mercury fillings, it causes more release of mercury when you have a cell phone next to your body than otherwise. So there's a lot of things surrounding metals in general. But we can definitely talk more about mercury in particular.
Well, just my input on it. Like Ben's talking about, when you pick up your cell phone and the signal comes, to your phone, people don't realize the signal actually goes to the metal first. So it disrupts the electricity of the brain dramatically. But when it touches mercury fillings, like what you mentioned right now, it releases mercury vapes into the body. So, and then when the dentist takes it out unsafely, there's a protocol of how to take them out, which the patient is supposed to be draped from head to toe. Oxygen is supposed to be placed for them. Hair is supposed to be covered. There's special vacuums to take it out. So when you drill on it, there's 3,000 microns per minute of mercury comes off. And if it sits on your skin and hair, it gets absorbed right away. And it goes to the pituitary gland, thyroid, and gets into the blood and gets into the organs. Very hard to detox, as you know. And so it's a big issue. So, and then that's how I got sick, myself, from taking out so many mercury fillings for so long. And I've been going through my protocol of, curing myself for the past 8 years. But that's what happens. When you get exposed to that much mercury, it becomes systemic, and it's very hard, as to take it out.
So shouldn't the dentist though also wear protective clothing? I mean, I'm sorry to hear that you actually got mercury toxicity from removing fillings. Are protocols in place to protect the practitioner, the doctors?
Yeah. We have to basically, there's a protocol per the Holistic Academy.
We're not taught this in school. Just remember this. This is not something that we're taught in school. Yeah. This is what we've learned after, getting more training and certification in this process. So
dentist doesn't recognize there's an issue as far as removing mercury fillings. They just tell us to drill on it just like a cavity, and you're fine. But it cannot go into an environment because it's a biohazard. It's very interesting. So, so basically, per our training in the Holistic Academy and biological conferences, there's a protocol of how you're supposed to be take it out, and we got certified in that. That, like what I was just telling you, we're gonna wear protective gear and mask and hair coverage, and the patient's gonna have that as well. And both of us are gonna take advantage of the vacuums that are next to our faces.
Not a regular surgical mask. These are actual masks that are made for toxic materials and so on and so forth. So we have to make sure that, yeah, the doctor's protected, the assistant's protected, the patient's protected. There's a whole system around this. Now, the sad thing is that, again, this is not only not taught in dental school, and it's not recognized as a problem where it is measurable when you are removing mercury, how much mercury is being released. And even if you're not removing it, like to your point, from the moment that actually mercury filling is put in the mouth, when you rub it on that mercury filling from a toothbrush, from grinding your teeth, anything, you can measure mercury being released from that. Now, the older it is, as it breaks down, it gets worse. So there's more and more mercury being released from these fillings. Now, so is there any good amount of mercury being released? I mean, is there any safe amount of mercury? No, obviously, any amount of mercury in your body is not good. So I would say, obviously, I'm looking forward to the time where we'll be banned in this country, because it's not banned. It's actually still being placed. It has been banned in other countries. In Russia, in the late 70s, they banned it. In Europe, as of this year, a lot of countries have banned it in Europe, but officially all in Europe, it's as of this year, is being banned. We are moving better in that direction. We have some leadership in the government that's now believing in this perspective. Fluoride has now been banned in 2 states. So we're hoping that amalgam fillings, the mercury fillings that they used to call silver, is next on that list. And we're expecting to work together with legislation to start moving in that direction to ban it. Because again, there's no doubt we know this is bad for you. In fact, as Shawn kind of alluded to, we're not allowed to have this mercury material go down the drain because we know it's bad for the environment. In fact, across the board, there is safety precautions that every dentist has to take. It's called an amalgam separator, that this keeps it from going down the drain. So we know how bad it is for the environment, because the number one source of mercury toxicity for the environment is these same amalgam fillings. So this is horrible for the environment, horrible for us. So hopefully soon it's not going to be a thing anymore.
We didn't, interesting. I didn't mention fluoride before you did, but I come to think of it, I would love to dive a little bit into that and understand. It sounds like you think getting fluoride out of the water is a positive step. Correct me if I'm wrong. I don't know the science on it. It's nothing that I've really looked into, but I know there's controversy around it. Or maybe you guys will say, look, it's not controversial. It needs to go. There's no benefit at all. But originally it was put in the water system for teeth, correct? Oral health?
That's what we were told.
Yeah. Yeah.
The science behind the stories behind what led to that, it's a waste material off of a different kind of manufacturing. But yes, it was put in the water for the idea of teeth, strengthening the teeth to prevent cavities. But now there's a lot of science behind it.
Does it work?
Well, in theory, it can potentially, not if you drink it. When you're drinking it systemically, it's not going to strengthen your teeth at all. Every science has shown that.
Wait a minute. Then why would it be in the water? Because people are drinking the water.
At best, it will be topically. It can potentially have some positive effect.
Interesting.
Topically.
That's a great question.
So why is it in the water? Again, there's a lot of conspiracy theories around this, which are not really, in my mind, conspiracy theories. There's no reason to have it in the water. In fact, there's a lot of science behind how much of a neural disruptor it is, reducing IQ for children in their development. So even if, let's say, it did strengthen the teeth a little bit, is that worth it for the health consequences and neurological disorder? Not worth it. There's much better ways to strengthen your teeth. So why use something toxic and have it in toothpaste and other such, where you're now, you should not be putting anything in your mouth like toothpaste that are toxic. You should be able to eat that toothpaste up and it'll be fine for you. So there's no reason to have a toxic toothpaste to strengthen your teeth. It doesn't make sense at all.
So you said topically, though, it can work to strengthen teeth, but your position or is that it should not even be in toothpaste? Is that
at all?
No.
At all. There's no reason to have anything toxic, remotely toxic. There's much better ways to strengthen your teeth.
So what about within the dentist's office, applying topically with a swab or something? Not even that.
It's too toxic.
There's much better ways of strengthening the teeth, like micronutrients. Nobody talks about it, of how much calcium you can pull from your blood into the teeth and the bones. Vitamin D's, magnesium, zinc, and K2. So we're more focused on pulling calcium into the teeth to strengthen them versus, fluorides and stuff like that, which, the studies are not very good on that anyway, even in topical. So, but yeah, that's just, part of the things that we're looking at biological dentistry about how to pull calcium to the teeth. Like what initially we talked about, we have something called a cone beam CT scan that we look at the whole skull in biological dentistry to be able to assess not just like little x-rays that when you go to the dentist to look at cavities. That's just part of it. And what materials we use for teeth. We're looking at the whole skull on a cone beam CT scan to kind of take a look at, teeth that are infected, hidden infections, which are a lot of root canals are infected. And, when you pull a nerve, which I know people have no pain at all, but they have bony infections and they have no idea. And this microtoxins are being released into the blood. Or dead teeth that they don't know about. There's areas of the jaw that did not heal. They're called cavitations. So there's a lot of things that we look at. Cavities is just part of it. Just a very small part of things.
To add to what Shawn's saying, John, cavity prevention is they only focus on hygiene, brushing, flossing. Generally, is what we've been taught. What we're looking at again, Shawn is saying the micronutrient levels. The oral microbiome. Your microbiome is such a big factor, and when it's disrupted. And there's an imbalance in that microbiome, is that's when a lot of times you get the gum issues, the gum disease, you get cavities, but also going down that chain, it disrupts your gut microbiome and other microbiome in your body. A lot of times, again, it starts in your mouth. So we rather focus on deeper issues than superficial topical issues. If we address the root cause of problems by mineral deficiencies, like Shawn said, microbiome deficiencies, then we can have better results as far as cavities, but you get much more. You get better health. So it's not just about teeth. That's the difference about biological dentistry and what we're talking about, is because we want to get to the root cause of problems and have the patient live a healthier life that will result in healthier teeth. Not get healthier teeth and everything else is crap. So we're focused on the whole body. That makes sense.
Well, and it's so interesting to me, and this conversation makes me think about, how I was trained as a naturopathic doctor in integrative medicine from the very beginning, how, our medical doctor colleagues are trained, how dentists, it sounds like, are educated in terms of, very much focusing on one organ system or one part of the body and not really thinking holistically. And of course, the jaw bones and our bones, and they're connected. Their health is a reflection of the health of every bone in the body, and osteoporosis risk and fracture risk and infections in one area of the body, can enter the bloodstream, and the molecules, the inflammatory molecules can cause problems with the heart. I mean, heart disease now is linked to gut oral health and oral hygiene. Talk a little bit about that, because that's, I think, a major issue for a lot of people, especially because heart attacks are, I think, still the number one killer in the United States. What is the relationship to the oral health?
I mean, to be honest with you, that's something conventional dentistry is already agreed to now. Like you're talking about right now, that anaerobic bacteria and the microbiome, when it changes like that, people don't realize when people come into the clinic, we have a wellness center here that encompasses functional medicine doctors and also biological dentistry and IV center. We're looking at the total body health, right? So people don't realize when they have severe gum disease, and I talk to them, I'm like, is this been a problem? No, not really. It doesn't bother me. So I haven't been to a dentist for 8 years. But they don't realize that same diseased microbiome not only is going to the gut, but like you mentioned, it goes to the heart. So the anaerobic bacteria, the same anaerobic bacteria that's causing heart disease is from the mouth. So there's a correlation there, which regular dentistry has already approved that. It's not controversial anymore. That part of it they talk about. They don't talk about the oral microbiome is really affecting the gut that much. There's no talk about that. And dentistry is basically, they treat us as like mechanics. You're the mechanic of the mouth. And that's how patients view dentists. out of broken something, fix it, go in there and kind of hammer it, paste it, glue it together, and you're fine. But like you said, teeth are organs. And whatever you do to these organs that are floating in the jaw, and people don't recognize teeth as being organs, affects the other organs in the body, which, like we talked about in the beginning of the podcast, through the meridians. So if you have diseased teeth or infected gums or infected teeth, it becomes systemic and affects other organs.
I mean, not only just through bacteria. As you mentioned, there's inflammatory markers like cytokines. Now, when you have inflammation in the mouth, which we know as gingivitis, right, or gum disease, periodontitis, these itises are inflammatory related disorders or diseases, right? Now, what we know 100%, and this is not, again, what Shawn said, this is proven science, is that these cytokines are traveling throughout the body, and they're bidirectionally affecting arthritis, other itises that show up in the body. So now, again, and like it's bidirectional, which means that if you have arthritis, for example, it can, or diabetes, these are all, it actually shows up in the mouth too. Now, again, this connection between the mouth and the body is the most important thing to keep in mind, because again, we can't have a healthy mouth and a diseased body, and you can't have a diseased, healthy mouth and a healthy body if you have a diseased mouth. So this is one of our biggest, things that we want to actually get out there. And because the future of medicine, we don't believe is this current model that there is a heart specialist and there's a skin specialist and there's an eye specialist and there's a teeth specialist. We believe that the future is a collaboration approach, and we have to work together, because yes, I might be a specialist in the oral head region, but if I work together with you as a naturopath, we can do much better for our patients than if you just focus on what you know and I focus on what I know. No, if we work together, we can do a lot more. Now, one more thing I wanted to add about what you said about heart disease. Yes, we talked about the bacteria in the mouth, but there's another big component from the mouth that actually contributes to heart disease, and that is airway. Sleep and airway issues are a big factor that also is overlooked in mainstream medicine, mainstream dentistry. We don't even discuss it in dental school practically, or in mainstream medicine. It's completely overlooked. But if you look at all the health consequences of someone that has airway obstruction, obstructive sleep apnea, they are tremendous. They're diabetes, erectile dysfunction, heart disease, stroke, acid reflux. A lot of the main things that people are taking prescriptions for are these same symptoms, same disorders that are related directly to sleep apnea. Not to mention the fact that people are tired, low energy, having a hard time to focus, also related to sleep apnea. So again, the mouth, this region here, that causes a lot of times the airway obstruction, which is connected to everything, your spine, your misalignment in your spine can be related to sleep apnea. So all this is connected. Yes, it might show up as heart disease, but the root cause can be much deeper.
And how does sleep apnea affect? And you didn't mention snoring, so I don't know if that's on the list as well. But how does that affect your oral health?
This is really important what Ben is talking about sleep apnea, because it was so important that we both went back to school in 2015 and became diplomats in sleep, which there's not too many of us throughout the country, that we kind of specialize in this area to kind of take a look and see the airway, right? And so a lot of patients, either they're referred by medical doctors to us to evaluate airway, or we're catching them in the wellness center ourselves. And so what happens is if you're having snoring, they come in for snoring. They have issues like, oh, my wife told me I'm snoring. I want to kind of take care of that. They don't realize that the airway, as the neck muscles, get more narrower, and the anatomy can be that way, you snore. But snoring is not the major problem. We want to make sure if they're choking at night, right, and the choking patterns, so they should have. We tell them to go get a sleep study done with a physician, which we do have a physician here in the clinic that prescribes that for us. And then we look at the sleep study and we go over it together and see if there's choking patterns in it. That choking pattern is related to what Ben's talking about, the comorbidities that you just mentioned, right? So, and then a lot of dentists, they don't realize that. They just put them in a night guard or a snore guard, which doesn't take care of the sleep apnea, which causes huge amount of problems in the future because it's like smoking. It kind of, there's layers to it. Eventually, they get a stroke or heart attack or whatever it may be.
So,
seniors.
John, we see signs of airway obstruction and sleep apnea in the mouth. So to your point, how does it show up in the mouth? It shows up as grinding. People that grind their teeth, very, very high chance that they have sleep apnea. People that you see the anatomy of the mouth where there's an enlargement in the tongue, of the tongue, scalloped tongue. And if you look at the back of the throat, you can't even see past the back of the tongue. In that scenario, the airway is a lot of times obstructed. And again, these are all different signs that we might see in the mouth. Also, what we see correlated with that is high blood pressure. Very commonly, very, very commonly, people that have high blood pressure is a correlation with sleep apnea. And they're taking, again, another prescription for that. So these are all things that we see showing up. And we ask our patients a few questions. It becomes very obvious that there is a sleep issue, and then they should get tested. And we have to get to the root cause.
We have tools that we use here in the center also, like a CT cone beam to look at the neck airway to kind of see, we can measure. There's machines like pharyngometer from Harvard that we can throw sound waves. If we see something, there's ways that we can indicate before they do a sleep study if there's anything going on.
Yeah, the approach is really phenomenal. I've never had such an in-depth conversation with biological dentists before. I've heard about it. I've maybe read a few things about it, but you seem to be taking this to a whole nother level. And, as you said, hoping that medicine as a whole begins to move in this direction, dentistry moves in this direction. And your clinic, and what you've created, is really thoughtful. You mentioned functional medicine practitioners in there. You're in practice with a medical doctor. You have all the integrative services there, so you're not just looking at the mouth or assessing the mouth. And it seems to me to be a real model of what integrative medicine should be, not just dentistry, but integrative medicine. And I'm just wondering, is this something that you think is available in other places around the country? Because people who listen to this are all over the place, around the country and around the world even. But can somebody access this, or is this just great information for them to start thinking about how to maybe improve their health in some way?
Great question.
That's a great point. It was our dream to build a center like this, to be able to have, like Ben said, total body health. And not just look at the head, not just look at the body. So when we created Smile Body here in LA, like I said, it's a wellness center. Now we have hyperbaric oxygen chambers and red light therapy and IV centers. Everything encompasses all together. But the way we're doing things now, because there are no other centers like this throughout the country that we've encountered. And
not yet, anyway.
Not yet. And so we're doing telecalls throughout the country with patients. We actually tell them, the functional doctors, they send them to go get CT cone beam scans. And then we do a telecall. We evaluate their CT scan on a telecall to see if they have toxicity coming from their mouth. And then once we figure out if they do have issues, normally people fly in to LA and we have accommodations. They stay here, and then we go through whatever we have to do to detox them and go through, surgeries or mercury removal, whatever it may be. That's how we do it right now.
Yeah, most people are pretty reactive when it comes to their health. So what do you see in terms of people reaching out for your services? What are they struggling with? What sort of symptoms or health experiences might give somebody a clue that they need to reach out to you guys?
It comes back to what I was mentioning earlier, John. If their doctor is really looking for cellular health and actually looking deep into it, getting them healthy from different things, thyroid issues, autoimmune disorders, cancers, a lot of stuff that's going on in their health. A lot of times the body naturally can heal itself, but it's under this major toxic burden, for example. As they try to relieve them of that toxic burden, these doctors that we work with throughout the country, they understand the oral component, because a lot of times the mouth is where the source of toxicity is coming from. So if you can do everything you can to do heavy metal detoxes and liver detoxes and gallbladder, all these things that you can do to clear your body. But if there's a stream of toxicity coming in, it's just like you're living in the moldy home still. So if you're living in the moldy home and you're trying to get healthy, you're not going to get that healthy. You can do all those detoxes, but you're not going to get there. So these doctors that we work with right now, they understand that. They want to help have a whole integrative approach, like you said, too. So that's when, they want their patients, as part of their process, to be screened by a biological dentist that understands these things, that looks for sources of toxicities in the mouth, from the metals, cavitations, infected root canals, these things, so that when you can relieve that source, now the patient can heal and go through their healing process. The doctor will have better results for their patients than if they just try to do it on their own. It's sometimes you're just hitting a brick wall if you're just trying to do it on your own. So this collaborative approach makes a big difference.
How can people find out more about your clinic? Where can they see more, reach you guys, schedule an appointment for telehealth with you?
My Smile Body is where they can reach us on Instagram or mysmilebody.com. And so, like I said, definitely a cone beam CT scan is critical. And then, like I said, we set up a telecall. We go over their toxicity levels, and then we accommodate them if they want to come down to the wellness center. We really appreciate that there's a movement that we're collaborating with people in Europe now, biological dentists, and we're trying to create a standard of what biological dentistry is supposed to be. Because a lot of people, they're trying to be biological dentists, but they're not sure about the levels of where they're supposed to be, and we keep pushing the envelope with people
protocols
right now.
The right way of doing things.
To kind of create a standard.
We're actually working together, creating protocols, as I mentioned to you when we met, for pre-workup, pre-surgery, getting the body ready, getting the terrain ready for healing properly, whether it's micronutrients, like the supplements that you share with your products. Eating, nutrition is a big component. Hyperbaric oxygen, IV therapies, pre and post. There's a whole protocols that are really critical.
Amazing. So smilebody.com is your website. It'll be in the show notes. Any last sort of parting words, anything you want to mention that maybe we didn't talk about?
It's mysmilebody.com.
Oh, sorry about that. Yeah.
The name is Smilebody, but the handle is mysmilebody.com, or on the socials, it's at mysmilebody. But we do a lot of videos that share this information on the socials. That's the best way to reach us.
Great. Looked like you might have wanted to say something, Shawn.
No, I was going to say, I really, really encourage people to kind of look at their oral health, and not in a sense of cavities. And so if the takeaway today, I want them to make sure they get a cone beam CT scan and look at the whole jaw and see if there's any infections, because there's a lot of hidden infections that cause systemic problems, and they're not getting to the root cause. And so medical doctors and functional doctors can't really help them without that.
I love that. That's a great parting advice. Thank you so much both for sharing some time with me and your information.